Hi all. So this is one of many posts I've had over the last almost 4 weeks now on how to prevent and cure autoimmune diseases. And the reason I'm so big on this is, of course, that they're epidemic. You don't hear anybody talking about this, but close to 25% of the American population, almost a quarter of people, are either diagnosed or have an autoimmune disease that isn't yet diagnosed. So this is a huge problem. And so it's a 1 in 4 chance you can get one. So pay attention, and if this is the first time you've seen me, go back and pick up on all the posts from the very beginning on this, because they build on each other. And it's a very complex topic. Not complex in that it's hard to understand, just complex that there's a lot of moving parts to it. So it's really good to go back and see the whole thing as you go through it. So today I'm going to talk about allergies, just basic allergies, so-called harmless allergies that many people have, and how if you're prone to an autoimmune disease, if you have the genetics, if there are other issues going on that make you prone to autoimmune disease, and you have allergies, how that can kind of push you in that direction. And also, if you have autoimmune diseases, how important it is to deal with allergies. So they can be a major factor in autoimmune disease because allergies suppress the Th1 part of your immune system. And if you followed some of the previous posts, you know that is the major lesion in all autoimmune diseases, is that part of your immune system called the Th1 system gets suppressed, and allergies can do that. Now, allergies come in two flavors, basically. One is food allergies. The other is environmental allergies, things like mold, dust, pollen, animal dander, etc. So when it comes to food, just remember, as Hippocrates said 2,500 years ago, one man's food's another man's poison. So in this regard, except for the junk and crap foods that being marketed out there, which are just horrible, nobody should eat them anyway. Except for that, perfectly good foods, you can be allergic to them. You can be allergic to wheat, you can be allergic to dairy, you can be allergic to oranges, just about anything. So one man's food's another man's poison. That's what Hippocrates said, and that's very true. So how do you know if a particular food is poisonous to you? Well, one way you can know about this is to do testing. You're going to have two kinds of food allergies. One kind of food allergy is immediate. That means you eat the food and within a matter of minutes or so, you're having a reaction. Those foods are pretty easy to identify because they're immediate. And those are what we call IgE immune-mediated allergies. The ones that are hardest are the IgG immune allergies, because those allergies are longer lasting. In other words, you eat the food now, but you don't really see the allergic effects of that food for maybe 4 or 5 days, and so you can't really make the connection. So how are you going to determine if you have any IgG food allergies? Best way is by getting some tests. You can get a blood test, and the blood test will analyze IgG antibodies for various foods. And if you come out with a whole lot of antibodies to a given food, there's a pretty good chance that that food is creating a problem for you, in which case you eliminate the food. And once you eliminate that food for about 6 weeks or so, its effect, you no longer have the effect from it. So keep that in mind. And if you have an autoimmune disease, go ahead and for sure have your IgG food allergy test, and then eliminate those foods that are positive on that test. In terms of the IgE foods, again, as I said, they're pretty easy to identify because they're pretty immediate. The most common ones here, by the way, are cow's milk, eggs, peanuts, tree nuts, fish, shellfish, soy, wheat, and sesame seeds. Those are the most common IgE food allergies. So if you're big on eating those things, you might want to try stopping them for a while and see what happens. IgG food allergies are, once again, they're delayed, and the most common symptoms of IgG would be gastrointestinal problems like bloating, gas, diarrhea, intermittent constipation. You could be diagnosed with irritable bowel syndrome, that type of thing. You can get hives, you can get eczema, skin rashes from IgG food allergies. Other potential symptoms of IgG allergies would be headaches, migraines, fatigue, muscle aches, inflammation, joint aches, things that you don't understand why you have these. The doctors test you and look at you and can't figure out what's going on. It could be an IgG food allergy. So kind of keep that in mind. The most common ones are to wheat, red kidney beans, peas, corn, and eggs, but you could have an allergy to darn near anything. Again, the best way to figure out if you do is to get the blood tests, and the treatment for it is just eliminate your exposure. If you're allergic to an environmental allergen, like dogs or pollen or dust or whatever, you're going to have to do some cleanup. You might have to get rid of the animal, you might have to develop air purification systems, clean up dust, etc., get rid of that plant that you're allergic to, and so forth. Because when you're dealing with allergies, it's pretty critical to eliminate your exposure to the allergens. So allergies are important. Pay attention to allergies. If you have an autoimmune disease, definitely look into this. And so thanks for listening. And if you want to know more about this kind of thing, please leave a comment on my bio. And also, please forward this post on to anybody that you know might be suffering from an autoimmune disease or might be interested in this topic. Okay, thanks.